Okay, we just want to take you to Santa Fe. A news conference is about to start.
Good afternoon, everybody. I'm Sheriff Adan Mendoza, Santa Fe County Sheriff's Office. With me today is Dr. Heather Jarrell, Chief Medical Investigator for the New Mexico Office of the Medical Investigator. Dr. Aaron Phipps, New Mexico State Public Health Veterinarian, New Mexico Department of Health, and also Chief Brian Moya, Santa Fe City Fire Department. This investigation started on February 26th with the discovery of Mr. Hackman and Ms Arakawa and their dog at their residence. I just want to do a short recap and then touch on some new information. As we know, both individuals tested negative for carbon monoxide. City Fire conducted tests and deemed scene safe for deputies to conduct their investigation. The preliminary pacemaker interrogation results were released last week, and I'll let Dr. Jarrell touch more specifically on those results. The gas company New Mexico, they also did an analysis of the residence, and they found one minor leak in a single burner on the kitchen stove, which was 0.33% of room air, which was pretty minute and insignificant. Since that time, Xena, the deceased dog, has been taken for necropsy at the Veterinary Diagnostic Services, and we'll be awaiting those results. Let's speak a little bit in reference to the timeline for Betsy Arakawa. We know from our investigation that on February 9th, 2025, she picked up Xena from Gruta Veterinary Hospital. There was a procedure that was done with the dog, which may explain why the dog was in a crate at the residence. Let's move on to February 11th, 2025. Mrs. Arakawa had an email conversation with her massage therapist at about 11:21 a.m. Moving on into the afternoon, Ms. Arakawa was at the Sprouts Farmers Market between 3:30 and 4:15 p.m. Ms. Arakawa was seen on surveillance video at the CVS Pharmacy in Santa Fe from 4:12 to 4:20 p.m. She then stopped at a local pet food store at about 4:54 p.m. Her car was seen on surveillance, and the remote control clicker that is assigned to her and her vehicle was used to enter the subdivision to gain access to the gated community at 5:15 p.m. Numerous emails were unopened on her computer on February 11th. There was no additional outgoing communication from her or known activity after February 11th, 2025. The cell phone information and the cell phone data is pending. We're working with state police to get the information from those phones, but our investigation shows that all the last known communication and activity from Ms. Arakawa was on February 11th. I'm going to go ahead and turn over the podium to Dr. Jarrell. I would ask that everybody refrain from asking questions until everybody has provided their statements. I'll step up to the podium, and then we'll go ahead and field questions from the media. Thank you.
Good afternoon, and thank you for being here. I'm Dr. Heather Jarrell, the Chief Medical Examiner for New Mexico at the Office of the Medical Investigator. I'd like to begin by stating that it is unprecedented for the Office of the Medical Investigator to make public statements about death investigations. However, the circumstances surrounding these two deaths require accurate dissemination of important information. I've also spoken with the Hackman family prior to this conference, who are aware of the autopsy findings and conclusions and are aware of this conference. On Thursday, February 27th, I performed an autopsy on Mr. Gene Hackman. Medical examiner Dr. Daniel Gallego at the Office of the Medical Investigator performed a full autopsy on Ms. Betsy Arakawa Hackman, also on Thursday, February 27th. By report, Ms. Arakawa Hackman's legal name is Betsy Hackman, which is how she will be referred to hereafter. The cause of death for Ms. Betsy Hackman, aged 65 years, is hantavirus pulmonary syndrome. The manner of death is natural. Autopsy examination and full-body post-mortem CT demonstrated no findings of trauma internally or externally, with microscopic findings consistent with hantavirus pulmonary syndrome. Laboratory testing was positive for hantavirus at a clinical lab, with required confirmation testing positive at Scientific Laboratories Division. Testing for COVID-19, influenza, and other common respiratory viruses was negative. Testing for carbon monoxide was negative. There were no other significant natural disease findings. Pills present on scene were thyroid medication, which were being taken as prescribed and is not currently a concern for a contributory cause of death. The cause of death for Mr. Gene Hackman, aged 95 years, is hypertensive and atherosclerotic cardiovascular disease, with Alzheimer's disease as a significant contributory factor. Autopsy examination and a full-body post-mortem CT examination demonstrated no acute findings of internal or external trauma and showed severe heart disease, including multiple surgical procedures involving the heart, evidence of prior heart attacks, and severe changes of the kidneys due to chronic high blood pressure. Examination of the brain showed advanced Alzheimer's disease, as well as blood vessel changes in the brain secondary to chronic high blood pressure. Laboratory testing performed at Scientific Laboratories Division was negative for COVID-19, influenza, and other common respiratory viruses. Testing for hantavirus was negative. Testing for carbon monoxide was negative. Additionally, there were no autopsy findings concerning for hantavirus infection. I have been asked when death occurred for these individuals. There is no reliable scientific method to accurately determine the exact time or date of death. Mr. Hackman's initial pacemaker data revealed cardiac activity on February 17th, with subsequent pacemaker interrogation demonstrating an abnormal rhythm of atrial fibrillation on February 18th, which was the last record of heart activity. Based on this information, it is reasonable to conclude that Mr. Hackman probably died around February 18th. Based on the circumstances, it is reasonable to conclude that Ms. Hackman passed away first, with February 11th being the last time that she was known to be alive. Lastly, clinically, hantavirus infection is characterized by flu-like symptoms consisting of fever, muscle aches, cough, sometimes vomiting and diarrhea that can progress to shortness of breath and cardiac or heart failure and lung failure. This occurs after a 1 to 8 week exposure to excrement from a primarily particular mouse species that carries hantavirus. The mortality of hantavirus, the mortality rate of the hantavirus strain in the Southwest is about 38 to 50%. The hantavirus strains in the United States are not transmissible from person to person. And so this is an appropriate time to segue to Dr. Aaron Phipps, the state public health veterinarian with the New Mexico Department of Health. But before I do so, I'd like to kindly ask for everyone to please respect the privacy that Mr. Gene Hackman, Miss Betsy Hackman, and their family and friends deserve. Thank you.